A 25-year-old woman presents to the clinic with a 1-week history of high-grade fevers, chills, myalgia, and night sweats. She is a volunteer for nature preservation programs in Africa and has recently returned from a trip to Botswana. During her trip, she took prophylactic chloroquine. She is physically active and regularly enjoys drinking grapefruit juice, but notes she did not consume it as much during her trip. Her temperature is 39.4 degrees Celsius, 102.9 degrees Fahrenheit, pulse is 86 per minute, respirations are 15 per minute, and blood pressure is 120/75 millimeters mercury. A blood smear is shown. Which of the following best explains this patient's current symptoms? Choice A, Babesia infection. Choice B, parasitic infection with resistance to chloroquine. Choice C, lead poisoning. Choice D, interaction of chloroquine prophylaxis with grapefruit juice consumption. Or choice E, schistosoma hematobium infection. We have this slide of a blood smear. Looks like a bunch of RBCs, and it looks like there's some ringed inclusions inside the RBCs. Anyway, I'll wait 5 seconds and then start answering the question. Alright, this is a pretty straightforward case. You have this patient that went to Africa, and she came back and she has this high-grade fever and febrile illness. And there's just not much else to go off of here. I mean, with the rings inside her RBCs, this is just very textbook Plasmodium infection, which is malaria. Choice B, parasitic infection with resistance to chloroquine, is the correct answer. Plasmodium falciparum is the most likely infection that she has. It's the most common Plasmodium infection there is, and resistance to chloroquine is very widespread in falciparum species. As far as the USMLE goes, from the questions I've seen, they don't really care about your ability to differentiate between different stages of malaria. You just need to know that it mostly is in Africa. You know, you have a travel history, and they usually give you the RBC smear with rings inside. They might show you like Schizonts or something, but even then, there's really not that many illnesses that cause these sorts of RBC inclusions that would also cause a febrile illness. I'll talk about one of them real quick once we get to the incorrect answers here. But pretty much the only other thing I can remember that they test sometimes is that Plasmodium ovale and Plasmodium vivax, they have the ability to become hypnozoites. So what Plasmodium vivax and ovale do is that when they're sporozoites, they go to the liver and they either develop into Schizonts or they can develop into hypnozoites, which are basically a dormant form. So if they give you a question where somebody goes to Africa and they come back and they end up having this malaria symptoms like months to years later, then your answer on that question would be Plasmodium vivax and ovale. That's the more specific thing I see them test on. You can also know that vivax and ovale have a roughly 48-hour cycle on their fevers, whereas Plasmodium malariae has a 72-hour cycle on its fever. We're talking super nitpicky stuff at that point. I mean, I don't want to say it's impossible that they'll test on it, but more often than not, they just stick to testing on falciparum and the fact that chloroquine resistance is widespread. And of course, they also like testing on Plasmodium falciparum because it's the most severe form of malarial infection. The fever is irregular. It can cause cerebral malaria. So let's just move on to the incorrect answer choices for now, okay? Choice A, Babesia. They really like making you differentiate between Babesia and malaria. Babesia has this very unique form in RBCs called the Maltese cross, which, as the name suggests, it's a cross-shaped inclusion in RBCs. But I should note that Babesia can also form ringed lesions inside RBCs as well, so that's what they like doing to make you confuse it with malaria. But you should never confuse the two, because Babesia infections, you'll only see them traveling within the United States, and that's pretty much the way you differentiate them. If somebody travels inside the United States and they get a parasitic infection in RBCs, that's Babesia. If they went to Africa before and they come back, then that's malaria. Really not that complicated. Only other thing I might note is that Babesia is spread by the Ixodes tick. Sometimes they like asking some obscure questions about vectors and which diseases are caused by which vectors, so that's probably worth knowing. Choice C, lead poisoning. It's a distractor. I mean, lead poisoning can lead to sideroblastic anemia, where you have basophilic stippling and ring sideroblasts, but nothing in this patient suggests that she has lead poisoning. She doesn't have any of the symptoms. Choice D, interaction of chloroquine prophylaxis with grapefruit juice consumption. This was just me being a jerk and trying to distract you guys with just this weird P450 interaction. While yes, chloroquine is metabolized by one of the P450 enzymes, many of you probably spotted it already if you have memorized your inducers and inhibitors, which is that grapefruit juice is an inhibitor, not an inducer. So even if you assume that she either misremembered or is lying about the fact that she didn't drink grapefruit juice on her trip, I mean, if she did, then if anything, she would be having some kind of chloroquine adverse drug reaction. Choice E, schistosoma hematobium. This is pretty much another distractor. I mean, yes, you can get schistosoma hematobium in Africa, but this causes totally different symptoms. It causes urinary symptoms. It's not a febrile illness. Occasionally, they like testing on the fact that schistosoma hematobium is a risk factor for squamous cell carcinoma of the bladder. And just as a bonus thing here, I didn't put it as one of the answer choices, but Trypanosoma brucei, which is African sleeping sickness, is another thing they sometimes make you DDX with malaria because it's also a parasitic infection from Africa. It's spread by the tsetse fly, and as the name implies, you'll have a lot of daytime somnolence. You'll be sleepy a lot, basically. You'll have weight loss and maybe some fever. Very definitively, if you do a blood smear, you'll probably see trypanomastogotes from African sleeping sickness, which, I mean, I don't know how exactly to describe them. They look like these tiny, spindly little worm things, but the main point here is that they're not inside RBCs, right? Which is what malaria is like. Anyway, bringing it back, this is a very simple question, honestly. Don't confuse yourself. If you see these ringed forms inside an RBC with all these fever-like presentation, and they went to Africa before, just straight up, Plasmodium falciparum, most likely. Most of it is resistant to chloroquine, and if they were never at Africa and they were in the northeastern United States instead, then you would be thinking Babesia. I hope this video was helpful. I'll see you in the next one.